Actress Fran Drescher is with us today to help us find better ways you can take control of your body and your health. The potentially life-saving test for women Kristen just asked about is called a transvaginal ultrasound. And Kristen's currently backstage with Dr. Lisa in our procedure room. Now, Lisa, tell us why this test is so important for women.
It's a way that we can actually look at the uterus, look at the ovaries, and make diagnostic decisions about what's going on with a woman. If she has ovarian cysts that need something done about them, or they're benign, or that they're potentially maybe cancerous, or that she has a thickened uterine lining that may need a DNC or an endometrial biopsy. So it gives us a lot more information than just the pelvic exam that we do in the office.
And Fran, you're passionate about this test yourself.
Yes, we've actually started legislation here in the state of California to try and make the TVU, the transvaginal ultrasound, like a part of every woman's annual gynecologic exam. Most women don't realize that when we get the Pap test, that doesn't cover anything north of the cervix. And when the doctor says your Pap test came back normal, they think, okay, well then I'm normal. But there really hasn't been a lot of diagnostic attention being paid to the uterus and the ovaries. And that's something that we think should be changed.
Well, we wanted to let women everywhere know what this test means. So, Lisa, take it away and talk to us a little bit about what you're doing while you're doing it.
And Fran's absolutely right. This gives us an extra pair of eyes. And right now, see, when we get right into the vaginal canal, you can see the bladder. Anything that is black is fluid on the ultrasound. And right underneath the bladder, and she has a very full bladder, sorry, Kristen, she's being a good sport, is the uterus. And the uterus is this nice oval shape here that you see. This bright white, and here is the lining of the uterus, and her uterus looks really nice. She has a little degenerating fibroid here. That just means that it's kind of almost curing itself by just collapsing on itself, and fibroids are benign. This is her left ovary, and she actually has a cyst on her left ovary. Remember again that any black on the ultrasound is fluid, and she has a cyst here, and it looks like it's about 1 centimeter. Which isn't, on the ultrasound, it looks large. This is the ovary right here. It's this almond-shaped thing. And again, on the ultrasound, it looks really large. This is the ovarian tissue, and this is the cyst. And this cyst looks pretty good, okay? The things that you worry about with an abnormal cyst is if it has septations, meaning little markings right in the middle of the cyst, if it has excrescences or solid things floating around in there, if it has a ground glass appearance, which might be an endometrioma, which is again benign. But this looks like a common cyst that a woman gets every month during her cycle. The egg bursts out when she ovulates. And where are you in your cycle right now?
About midway.
About midway. So we would expect to actually see a cyst on her ovary. So this can be completely normal. All right?
And Dr. Lisa, who would be an ideal candidate for this test?
Somebody who's had a family history of ovarian or breast cancer, because remember they're connected. Someone who's had cysts before that may have been benign, like dermoid cysts or other cysts that might come back. So that's very important to have. Somebody who's had irregular bleeding, or someone who has pelvic pain, because this is one way, because if you have a really large cyst, that's another thing to worry about, because it can twist, and that can be an emergency. All this took, minutes here, and this can be done in the office. It gives us some eyes on the pelvic exam, which is just the hands. We can feel a lot on the pelvic exam, but we can't see, and this makes it, much more accurate.